a lot of people see these pandemics and these, epidemics of viruses like the flu or like coronavirus, you could say, as short term in their own right, that they would be over, apparently it was supposed to be 2 weeks to flatten the curve, or 2 years, but we don't expect this to go on forever, hopefully, fingers crossed. But we do expect chronic infectious disease to go on, like Lyme disease and tons of other infections, that EBV, Babesia, Giardia, any type of infection you can name that can be chronically held and cause serious repercussions. How can we take what we're talking about here and apply that to chronic disease? Because in this discussion, it is a lot about, I think, healability in nature and going that natural course, improving your immune system, a slower process versus the short-term citing of pharmaceutical intervention, which goes after symptoms and tries to, look at the germ. I think, what this comes down to, and we've talked about this a bunch, is that kind of terrain germ theory and how you look at both sides of that. Whereas in pharmaceutical, you look at the germ, you isolate it. That is the bad thing. We have to attack that. In European biological medicine, you look at the terrain and you really work on that and cleansing the terrain where the germ can't work. But I know you have a feeling it's kind of in the middle there. So can you explain what your kind of stance is on how we could apply what we're talking about here in pharma versus nature to chronic infectious diseases?
Yeah, sure. Whenever we're talking about any sort of treatment, whether natural or pharmaceutical, I think we have to also include in our line of thinking and include in the discussion the body's role and how we can not just use these tools available to us to, influence the body in a positive direction, but also how we can prime the body or optimize the body to do what it naturally does. I think the failure to discuss the body's own capabilities is kind of missing out on more than 50% of the whole conversation here. And to me, this is the most fascinating part. So it's really, not necessarily just a question of, is this thing going to help us or harm us, but also really, first and foremost, what can we do for our own health, to support our own body, mind, immune system, nervous system, everything else, so that natural state of health really can start to prevail.